What is carpal tunnel syndrome? Carpal tunnel syndrome is a condition that affects the hand and wrist. It occurs when the median nerve, which runs from the forearm to the hand, becomes compressed or squeezed at the wrist. This compression leads to various symptoms such as numbness, tingling, weakness, and pain in the hand and fingers. What are the possible causes of carpal tunnel syndrome include 1. Repetitive hand and wrist movements. Activities that involve repetitive motions of the hand and wrist, such as typing, using a computer mouse, or playing musical instruments, can contribute to the development of carpal tunnel syndrome. 2. Hand and wrist position. Continuous and prolonged flexion or extension of the hand and wrist, especially during work or sleep, can increase the pressure on the median nerve and lead to the condition. 3. Medical conditions. Certain medical conditions like arthritis, diabetes, obesity, hypothyroidism, and pregnancy can increase the risk of developing carpal tunnel syndrome. 4. Trauma or injury. Fractures, dislocations, or sprains of the wrist can cause swelling and compression of the median nerve, resulting in carpal tunnel syndrome. The treatment and interventions for carpal tunnel syndrome may include 1. Rest and immobilization, taking breaks from repetitive activities and avoiding activities that worsen the symptoms can help alleviate the pressure on the median nerve. Wearing a wrist splint or brace may also help to immobilize the wrist and reduce irritation. 2. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, or oral corticosteroids may be prescribed to reduce inflammation and relieve pain. 3. Physical therapy. Stretching and strengthening exercises for the hand and wrist can help improve flexibility and reduce symptoms. Additionally, techniques such as ultrasound therapy or nerve gliding exercises may be used to alleviate compression on the median nerve. For lifestyle modifications, making ergonomic adjustments to your workstation, maintaining proper posture, and using ergonomic tools can help reduce strain on the hand and wrist. 5. Corticosteroid injections. In some cases, corticosteroid injections may be recommended to reduce inflammation and provide temporary relief from symptoms. 6. Surgery. In severe or persistent cases, surgery may be considered. The most common surgical procedure for carpal tunnel syndrome is called carpal tunnel release, where the ligament pressing on the median nerve is surgically divided to alleviate the pressure. It is important to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan for carpal tunnel syndrome. Now I will tell you the wrist joint motion. The wrist joint allows for several motions, including 1. Flexion, bending the wrist forward, bringing the palm closer to the forearm. 2. Extension, bending the wrist backward, moving the back of the hand closer to the forearm. 3. Radial deviation or lateral flex. Let me repeat. 3. Radial deviation or lateral flexion, moving the wrist towards the thumb side. 4. Ulnar deviation or lateral flexion, moving the wrist towards the pinky side. 5. Pronation, rotating the forearm and wrist so that the palm faces downward. 6. Supination, rotating the forearm and wrist so that the palm faces upward. These motions allow for a wide range of movement and flexibility in the wrist joint.